Hi all, welcome back to Just Talks. So in this session, we'll be discussing about the treatment plan for personality disorders. So far we have discussed about personality disorders, what is personality, different types of personality disorders, their symptoms, the causes, everything we have discussed. So before watching this video, if you have not watched the previous videos, please do watch that videos. Okay, so let's see what are the treatment plan. So here we will be discussing about the treatment modality under psychological, social and biological. So treatment, psychological and social. Okay. So psychotherapy is at the core of care for personality disorders because personality disorders produce symptoms as a result of poor or limited coping skills. Psychotherapy aims to improve perceptions of and responses to social and environmental stresses. So, for personality disorders, psychotherapy is very important because personality, we know that personality disorders, the symptoms are mainly like the person is not able to cope with the surroundings or cope with his or her behavior. So, psychotherapy always, the aim is to improve the perception and the way he or she respond to the environment or the social stressors. So, the person basically, fails to cope with the stressor. So, psychodynamic psychotherapy. This examines the ways that patients perceive events. So, based on the assumption that perceptions are shaped by early life experiences. So, psychotherapy aims to identify perceptual distortions and their historical sources and to facilitate the development of more adaptive modes of perception and response. So, psychodynamic psychotherapy, this basically examines a patient's perception, how he or she perceive a particular situation, all these things. That is what this is mainly based on. So, its aim is to identify what are the perceptual distortions or historical sources and to facilitate the development of more adaptive modes of perception and response. Treatment is usually extended over a course of several years at a frequency from several times a week to once a month. It makes use of transference. So next we'll see what is CBT, that is cognitive behavior therapy. It is mainly based on the idea that cognitive errors, mainly the person's thoughts, based on long-standing beliefs, influence the meaning attached to the interpersonal events. So it deals with how people think about their world. So that is what is cognition and their perception of it. So cognitive behavior therapy, it mainly focuses on the way a person thinks about a situation or the world or his or her perception. This very active form of therapy identifies the distortions and engages the patient in efforts to reformulate perceptions and behaviors. So basically, this therapy it mainly the idea is to identify the the thinking distortions, and what it does is that it changes the person's thought or the perception or the behavior. That is what the aim of this therapy is. This therapy is typically limited to episodes of 60 to 20 weeks, once weekly. In the case of personality disorders, episodes of therapy are repeated, often over the course of 2 years. So, in case of personality disorders, it is repeated over the course of years. Okay, so that is CBT. So next is interpersonal therapy, IPT, interpersonal therapy. So it conceives of patients' difficulties resulting from a limited range of interpersonal problems. Like from the word itself, therapy, interpersonal therapy itself, we know that is limited to interpersonal problems. So it includes issues as role definition and grief. Current problems are interpreted narrowly through the screen of these formulations, and solutions are framed in interpersonal terms. Therapy is usually weekly for a period of 6 to 20 sessions, though empirically validated for anxiety and depression, and it is not widely practiced, and therapists conversant in the technique are difficult to locate. So it is not widely used. So basically, it is based on interpersonal problems, and through it is the solution is also through interpersonal. Next is group psychotherapy. This allows interpersonal psychopathology to display itself among peer patients. So it is among groups whose feedback is used by the therapist to identify and correct maladaptive ideas, communication, and behavior. So sessions are usually once weekly over a course that may range from several months to years. So that is group psychotherapy. Next, we'll see what is DPT, that is dialectical behavior therapy. It is a skill-based therapy, and it is developed by Marshall Linehan, PhD, that can be used in both individual and groups. So this can be used in both individuals and groups, and it has been applied to borderline personality disorder. The emphasis of this manual-based therapy is on the development of coping skills to improve affective stability and impulse control, and in reducing self-harming behavior. These are main characteristics of borderline personality disorders. So DPT mainly focus on the coping skills. Next, we'll see the biological treatment plan. Medications are in no way curative for any personality disorder. They should be viewed as an adjunct to psychotherapy so that the patient may productively engage in psychotherapy. So, both medications and psychotherapy is must. The focus is on treatment of symptom clusters such as cognitive perceptual symptoms, affective dysregulation, and impulsive behavioral discontrol. These symptoms may complicate almost all personality disorders to varying degrees, but all of them have been noted in borderline personality disorder. The assumption is that neurotransmitter abnormalities underlie these symptom clusters that transcend the concepts of axis 1 and axis 2 disorders. The strongest evidence for pharmacological treatment of personality disorders has been for borderline personality disorder. But even this is based on a fairly small database of studies. So there are some drugs that is commonly used: antidepressants, antipsychotics, and anticonvulsants. Next, let's see that was about treatment plan. Next, let's see what are the complications of personality disorders. So it can lead to suicide, substance abuse, accidental injury, depression, homicide. That is a potential complication, particularly in paranoid and antisocial personality disorders. So these are some of the complications. Some personality disorders may lead to suicide, substance abuse, depression, all this. Next, let's see prognosis of overall personality disorders. So, personality disorders are lifelong conditions. So we can just make it we can just control personality disorders, but it is a lifelong conditions. Attributes of cluster A and B personality disorders tend to become less severe and intense in middle age and late life. So, during a person's middle age and late life, personality disorders cluster B becomes less severe and intense. So, patients with cluster B personality disorders are particularly susceptible to problems of substance abuse, impulse control, suicidal behavior, which may shorten their lives. Cluster C characteristics tend to be exaggerated in later life. So this is the prognosis of our overall personality disorders. Next, let's see what are the prevention. Within the limits of contemporary medical knowledge, personality disorders cannot be prevented, although steps can be taken to prevent or deter some of the consequences and complications of personality disorders. So we cannot prevent personality disorders. We can just take some steps, and we can, as I told you, we can just control the personality disorders. Frequent inquiries about suicidal ideation are warranted, regardless of whether the patient spontaneously raises the subject. The physician need not fear instilling the idea of suicide in a patient who is not already entertaining it. Subsequent inquiry about firearms, lethal medications, and other available means of suicide point to avenues of preventive behavior. Benzodiazepines, narcotic analgesics, and other drugs with potential for dependency should be used rarely and with great caution. Nearly all personality disorders are marked by impaired impulse control and consequent risk of addictive behavior. Patients with personality disorders who have children should be asked frequently and in detail about their parenting practices, their low frustration tolerance, externalization of blame for psychological distress, and impaired impulse control put the children of these patients at risk for neglect or abuse. So, this is very important. If the patient with personality disorders, if they have children, it is very important to ask about their parenting styles. We need to guide them, otherwise children are also at risk for neglect and abuse. So these are some of the prevention things. So far we have discussed about personality. In short, we have discussed everything. We have discussed the treatment plan. Different types of personality disorders have been covered in all the three. Within 3 sessions I have taken, so I've covered everything. So hope this is clear and informative. So please do watch and do not forget to subscribe. And thank you so much for watching. So see you in this next video.